McQuestion. For over 25 years, talking about things that matter with people who care. Production of McQuestion is made possible in part by individual viewers, supporters of the Foundation for Responsible Television, CF Accountants and Consultants, adding value to clients throughout the region, the University of Texas at Dallas, creating the future.
You know, we've talked about healthcare on this program more than any other subject, and today we'll continue that trend as we look back at the history of healthcare in America. Now, you're probably in the majority if you think that our system is too complex and too expensive, and yet it underserves many. There are reasons for this, and they may not be the reasons you're familiar with. But in addition to the public policy issues, such as the Great Society, which spawned Medicare and Medicaid, we'll examine some of the more remarkable discoveries in healthcare up to the year we began this program in 1990. So let's meet our experts, starting on my left. An award-winning doctor is recognized by Texas Monthly and D Magazine. Dr. Michael Weisberg has been a practicing gastroenterologist for 23 years. He's also a writer, and his first novel is for adults. It's called The Hospitalist, so watch for this, okay? Michael, welcome to the program.
Thank you, Dennis. Thank you for having me.
Sitting next to you is Dr. Adam Myers. He became Chief Medical Officer of Texas Health Physicians Group in 2013, certified in family medicine, healthcare quality management, patient safety, as well as healthcare risk management. Adam, welcome to the program.
Thank you, sir.
And sitting next to you is a legend in Dallas County, at least in his own mind, right, Don?
Yes.
Don Reed. Dr. Don Reed has served in leadership positions in medical societies locally, and he's president-elect of the 48,000-member Texas Medical Association. He specializes in colon and rectal surgery, and he's a longtime member of the Rotary Club of Dallas. We couldn't forget that plug, could we, Don?
Right.
So welcome to the program.
Thank you.
So look back now at the history of medicine before 1990. Take us back wherever you want to go, because I told you when we talked before this program, I had this great cartoon. And the cartoon shows a young man sitting and studying at his desk, and he's looking up at his dad, who's looking over his shoulder. And the son says to the dad, "Well, of course you were good at history, Dad. You were there for most of it." Okay, so in your case, Don, you've been there for most of it. Talk to us, please.
That's right. I have been there for most of it. We trace our Western medicine history back to Hippocrates in 400 BC, but there were actually two medical texts before that. There's an Edwin Smith papyrus from Egypt on the treatment of trauma that was from 1600. And between 1200 and 1600, there was an Indian doctor by the name of Susrata who wrote a Susrata Samhita, which describes techniques for surgical operations, hernias, laparotomy, C-sections, even cataracts. Back then, they used these great big giant army ants that had big pincers, and when there was a wound, they'd hold the ant up there, and the ant would bite the two edges of the wound and hold it together, and then they'd jerk the body off, and they'd just keep doing that. That was our early suturing.
Don, now wait just a minute. With all due respect, Michael's book is a novel of fantasy. You have just told us a story that can't be true, can it?
It is true.
Are you serious?
Yes.
Wow.
But what most people who are under 40 or 50 years old don't realize is that the most important advance in medicine was the control of infectious diseases. In 1900, 30% of all deaths occurred in children under 5. Those are from infectious diseases. 12% of deaths in 1930 were from TB. Smallpox had a 30% mortality. And so historically, most people died as a kid. And we went to a cemetery in Springfield, Massachusetts one year, looking at the gravestones, looking for some of my wife's family members. And there were 3 categories of graves. There were children, there were men between 20 and 40 with a military rank, and there were people in their 80s. So people could live a long time, but they all died of infection, mostly of infectious diseases. So vaccines and antibiotics were the 2 biggest invention in that regard. Insulin for diabetes preceded that a little bit. Insulin came along in 1924. Before the introduction of insulin, type 1 diabetes, that is to say you inherited it, showed up in children, usually by the age of 10. And at that time, if you were diagnosed with diabetes, it was very unlikely you would live more than a year or a year and a half. the only treatment was basically semi-starvation. So insulin made a huge difference in that. We had Edwin Jenner with smallpox vaccine in 1798. And finally, smallpox was eradicated from the entire world since it was a human-to-human transmission. And we got rid of that. It was declared gone in 1980. 1980 was, in the 1980s, as you know, is when Rotary International started a program to eradicate polio around the world. And we're almost there. Afghanistan and Pakistan and sometimes Nigeria are the last remnant places where we have trouble with that. But people don't realize that all these wonderful antibiotics that we have now, we didn't have. The first antibacterial were sulfa drugs. They came along in 1932. Penicillin in significant quantities was first produced just before the invasion of Normandy in 1944. Since then, there have been a plethora of antibiotics, and now we can treat all sorts of things that we couldn't before. In 43, streptomycin was the first drug that could treat TB, and we've had other drugs since then. But the eradication of infectious disease is far and away the single biggest advance in medicine in our lifetime.
Okay, good. Now, Adam, you've heard that great story. You're obviously way too young to remember all the things that Don did. Give us some of your advice, please.
Absolutely. I harken back to one of my medical school professors who shared with me that when he graduated from Harvard, his commencement speaker spoke in great detail about the virtual benefits of leaving 1 or 2 windows open in the rooms of patients who had pneumonia. There was actual scientific study about how many windows is it appropriate to leave open. We've come a long way since then, and although you can't even open the windows in hospitals now, but antibiotics really have been hugely impactful into the outcomes of health for all people in the world. Some of what we view as archaic treatments from the past still have a place, though. I mean, I think about, it used to be that people thought that the origin of disease was from evil humors, and bloodletting was one of the treatments of choice. That's fallen by the wayside. However, leeches, which were used back then, are still in use today at times in plastic surgery and in the reattachment of limbs. Leeches, sterile leeches can be used for that.
We got ants and we got leeches.
Absolutely.
I'm not sure we really want to do this. That person watching this program is probably going to throw up when they hear this kind of stuff.
Medical grade leeches still in use today. So, and the other thing that's very interesting as well is that people don't often realize that the origins of many of these antibiotics come from nature itself. I think of one particular class of medications, chemotherapy drugs. Adriamycin is a chemotherapy agent, and it was discovered on an island in the Adriatic Sea where there was a log that had this fungus growing on it, and there was nothing else growing anywhere within feet of that fungus. And so they determined maybe there's something going on here. Grabbed samples, studied it, and from that came a chemotherapy agent. The foxglove plant is the origin of digoxin, which is a very commonly in the past used medication for cardiac patients to help with arrhythmias. So lots of these advances came from nature but have now been refined and applied to our health today.
Well, I think that's interesting because we've done some programs in the past on, let's just say, supplements as opposed to drugs, and most of those things come from nature, some of which, I guess in China, right, have been at least being used for all kinds of diseases for literally millennia, which is important. Michael,
Yes.
what about what they've said? What would you like to add on to it? And particularly if you would bring us into one of the things we have faced in this time that we've hopefully gotten rid of, or at least been able to treat, is something called AIDS. So talk to us about those things.
I think that what they've said is true and interesting. I think the one other point that I'd like to make is the training programs of doctors and how that has evolved. As he mentioned, the first medical schools may have been thousands of years ago, but in America, it really wasn't until the 1700s in Pennsylvania that the training of doctors started to become standardized. And it wasn't until after Johns Hopkins' death and his leaving money for a medical school to be built that we really started getting into more modern medical training. A lot of it had to go over to Europe for the scientific method, to get away from the idea of just taking care of patients, whatever they had, but instead trying to do research, trying to look into what actually was causing the disease, what was the problem. And as Johns Hopkins, there was a man named Welch who took over his Johns Hopkins, and then he had men who came after him who not only were working on their medical school, but were raiding other medical schools in this country, whether they were A, B, or C, and trying to get rid of schools that were B or C, that didn't train doctors appropriately. And I think the training has progressed tremendously, so that now I think that in America we have a great training program to get doctors out there that know how to take care of patients, that know how to utilize these various advancements, drugs and things like that. So I think if you're going to have the advancement, it's great, but you've got to have the people along with it who know how to use it. And I think that's the other thing that's come up. Now you mentioned AIDS. I trained in the era of AIDS. I went to medical school from 1981 to 1985, which is when AIDS came out. And all we saw, we would be in the emergency room, both as a medical student and as a resident, and we'd see these young men coming in dying in front of our eyes. Almost all homosexual men, some IV drug abusers. And basically it was thought that if they had pneumocystis, pneumonia, or certain things, there was no reason to intubate them, they were gonna die. And a lot of them, we had special wards. I trained in Houston, and I was at Ben Taub Hospital, but we had special wards at Jefferson Davis Hospital in Houston just for AIDS patients. Just in the time that I trained, I saw tremendous advances in the treatment of AIDS patients as they started to understand the disease more. They started to understand the transmission more to try to keep this from being a plague-like thing that was being transmitted from person to person. And over time now, it's a disease that's become more of a chronic disease, where people can live with this disease and live years and years with this disease. So the advancement has been tremendous. For those of us who are on the front lines, though, when AIDS first came out, it was scary. We didn't know what was going on. We didn't know how it was transmitted. We didn't know why these people were dying. Now we understand that, and I think it's gone from the realm of being scary to something it's understood and that's treated.
We appreciate all the things you guys have done. Now, what a great story. Adam, I'm going to ask you about one of my favorite retired doctors, a guy named Stan Feld. He's sitting in the audience back here. And if there's anything that he has tried to teach me when I'm a hard person to learn stuff, particularly in the past, before 1990, the importance of a doctor-patient relationship. Tell us what that was like for that person who probably wasn't here at that time and doesn't know what a doctor-patient relationship was, and maybe we still have them, I don't know, do we?
We do still have doctor-patient relationship, but it's significantly more fragmented than it used to be. Back before the 1990s, you could think of and maybe characterize this as almost the Marcus Welby era for physicians and the doctor-patient relationship. Doctor was more than likely a generalist, and they knew their subset of patients well. They knew them by name. They lived in the same community with them and interacted with them in community events. They were oftentimes viewed as leaders of that community. They typically had a private practice with maybe one or two other physicians, but oftentimes they were solo practitioners. And wherever and whenever their patients needed assistance, that's where they were. Whether it be a house call, a hospital visit, there weren't emergency room physicians oftentimes staffing the hospitals. If one of your patients went to the emergency room, you went to the emergency room to take care of them. There weren't hospitalists who were inside of the hospital so that you could continue to see patients in your ambulatory setting. You followed the patient to the hospital. So that piece of the relationship has really changed. It's much more fragmented.
Is that a good thing or a bad thing? I mean, it just seems, maybe I'm just too old, but maybe, it just seems like those were the good old days.
Well, aspects of it are a necessary thing. Frankly, as we've gotten better at the technological side and the advancement side of medicine, it's not possible for individual physicians to keep up with all of it and be all things to all of their patients. It's just not possible. The wealth of knowledge that's involved in medicine doubles about every 4 years, just the volume of knowledge. And people have talked about the possibility of extending medical school and training in order to try to absorb more of that. That doesn't make the past knowledge irrelevant. You have to have that in order to build upon it with the new. But frankly, I wouldn't want one person taking care of all aspects of my care. But we've taken it, I think, a bit too far. And that's the reason why we now have certain measures about patient perception of care in HCAHPS and CGCAHPS to try to help bring back a more emphasis to that doctor-patient relationship.
Okay, he mentioned something called technology, Don. So go ahead and say what you were going to say, and then follow on with technology, if you will.
Okay, well, I think the single saddest thing for me to observe in medicine is the loss of the primary care patient-physician relationship. When I went into practice, the primary care physician would send me a patient and said, you know, this guy's having pain, I can't find anything, he looks perfectly normal to me, but I've known him for 20 years, he never complains. So there has to be something wrong with him, and send him over. Sure enough, there was something wrong with him. When PPOs came along in the 1980s,
PPOs?
Preferred Provider Organizations, which had a narrower panel, you had to pick the doctor that was on your insurance plan. That's when we first started doing that. And then every 2 years, you'd switch insurance plans, you'd have to pick a new doctor on a new insurance plan. So we completely destroyed that long time primary care patient-physician relationship that we used to have. They still have it out in rural areas, but here in the cities, that all went away. And I think that part was very detrimental. We now say, oh, we need a medical home. Well, we had the medical home until PPOs came along, because the primary care physician knew all about
And
the patient.
PPOs came along because
They were trying to reduce the cost of care.
And that came along because
Because care costs too much.
care costs too much because
Well, what PPOs succeeded in doing was that they reduced the cost of care in some areas, primarily in hysterectomies and tonsillectomies. So they got that part of it out, but then there was a plateau.
But what came along here in the 60s that changed all this stuff in terms of expense? Adam, you're smiling.
More people enrolled in the insured population.
Okay, so
That meant more people were covered. The overall
It's a good thing.
which is a good thing.
Okay.
The overall spend therefore goes up, and you have a coincidence of that with greater technological advancement in healthcare, and the latest greatest technologies are typically not the least expensive.
Mm-hmm.
So if you have more people availing themselves of treatment and more treatments that are now available that are more expensive, you have a cost curve that accelerates pretty dramatically.
it's hard to bend it. Now, who's the biggest payer these days of the third-party payers? We've got insurance companies, and who else, Michael?
Well, Medicare.
Okay, what
And
is Medicare? What's that all about?
Well, Medicare is for everybody over the age of 65. You automatically get that. And when they've done studies and looked at it, about 90% of the entire bill of a person's medical care in their lifetime is spent in the last 6 months of their life. So that we're saying you live 85 years, and for 84 and a half years, you spend 10% and then 90% in the last 6 months. And I think that now that we have new ways, new treatments and things, we can keep those patients alive even longer. And there's tremendous cost. There was all this talk about death squads and things like that with Obamacare and things. But I think the bottom line is that to get a reasonable hold on medical care, we've got to look at what happens and how we're going to treat people in those last 6 months of their life, especially people whose lives, who may not be with it, may not be with it mentally, may have Alzheimer's, may have other problems. But we can keep those people alive, and it's expensive.
Yeah, expensive. Now, Don, what did we used to do before 1965, if you were told about that? I know you weren't practicing there, but what did we used to do before Medicare and Medicaid?
When I went into practice in 1978, patients came in, they paid their bill. If they had insurance, Blue Cross showed up in 1929 as the first insurance company. They paid their bill to me. They submitted my receipt to Blue Cross, and then Blue Cross paid them. So it was late in the 80s before we started submitting the insurance form to the insurance carrier. Before that, the patients always did it. So the patient knew they were paying a bill, and they had a very finite interest in what it was going to cost to do each of these things.
What an idea, the price system. How much is this going to cost, Adam?
Yes.
People used to ask that question, no more. How about Medicare? Who pays that bill?
Well, the Medicare bill is paid by all of us who pay taxes, frankly.
Pay taxes, yes, pay taxes. So before I go, and I'm going to spend some time closing this program, Medicare, Medicaid, good idea, not a good idea?
I think it's a good idea, but I think everyone should have health insurance, but I think it could be run better.
I would echo that.
I agree. We all need to be covered. Medicare has done very well. Medicaid has not done very well, and there should be some fix to the whole system.
Okay, from a public policy standpoint, there might be some disagreement about that in terms of Medicare and Medicaid, since that is, in fact, the biggest financial challenge for students and other younger people today. So let me, I hate to close you off right there, but I need to not use as much time as I do here, but this is a very special occasion. So what I'm recommending, what I think is the most important book, if you'll give me that book here, thank you. This book is called Code Blue. It's the most important book on healthcare, or almost any other subject that you'll read, written by the late Dr. Ed Annis. And I'm going to show you a brief clip of the time he joined us about 20 years ago. But before I do, let me tell you that this book chronicles how communist, socialist, liberal, progressive thinking has ruined the delivery of healthcare as we used to know it. Notice I didn't say Democrats, though many of them were, because Dr. Ed Annis himself was a member of the Democrat Party. But he was also a free market person who knew healthcare. In this book, Dr. Annis lays out how Fabian socialists in England, along with trade unionists, concocted the doctrine of permeation, defined as accepting, instead of trying to supersede, the existing political organizations which it intended to permeate with the socialist conception of human society. Men such as George Bernard Shaw, Sidney Webb in England, Walter Reuther, Hubert Humphrey, John Dewey in America, combined permeation with gradualism instead of revolution to socialize America through the socializing of medicine and healthcare. The book quotes Arthur Schlesinger Jr., the Harvard professor and historian and co-founder of what became the Americans for Democratic Action, a communist organization, by the way, that changed their name in 1947. Schlesinger was close to President John Kennedy and was instrumental in gradually getting the socialist agenda into the mainstream of America. Legislation was introduced in 1961 by Senators King and Anderson, and it became known as King-Anderson. The unions prevailed on Senator Kennedy to make a speech on the legislation on May 20th, 1962 to 20,000 people in Madison Square Garden. The picture you're seeing right now is of President Kennedy making that speech. The American Medical Association rented the Madison Square Garden that night so that one person, Dr. Ed Annis, could speak in rebuttal to the president. That speech was broadcast the next night on only one network. 30 million Americans watched Dr. Annis speak to an empty Madison Square Garden, and his passionate speech helped pave the way to defeat King-Anderson a couple of months later. Alas, just over a year later here in Dallas, on November 22nd, 1963, the world witnessed a personal and political tragedy that had ramifications on healthcare, as you'll see. Here's Dr. Annis talking about the birth of Medicare and Medicaid.
King-Anderson legislation is known today as Medicare. My introduction, along with many other doctors, was in our opposition to what became known as Medicare. But our opposition was based very similar to the basic philosophy that I enunciated, and that is that people able to provide for themselves should do so. They shouldn't be provided by government regulations through taxes. When I argued at that time against a policy that would give immediate entitlement to everybody just because they had a birthday.
So and what age was it at the time? 65?
At that time, they took 65. Now, at that time, when Medicare was passed, there were 16 million people over the age of 65, including my mother and dad, both of whom had their own insurance. I remember the day when my mother called all upset because she'd been notified from the insurance company they were canceling their insurance as of the end of June. She said to the insurance man, "What do we do? Where can we get it?" He said, "You can't. You have to take Medicare or you won't have insurance." Mind you, they were among the 7.7 million of the 16 million who were paying for their own insurance. They immediately became entitled to health care coverage to be paid for by younger working taxpayers. Now, at that time, there were 15 workers paying taxes for everyone over the age of 65. Today, the last figures out of Washington some 6 or 8 months ago was now there's 3.4. Less than 4 workers are being taxed for every one of us over the age of 65 who are entitled to coverage to be paid for by the government. This is where the problem has arisen, and this is why today, one of the major problems we have, and one of the reasons for the tremendous increase in cost to the private sector, Medicare isn't paying what it costs to provide services. Medicaid isn't taking care of what it promised to take care of the poor. Now, if our government can't take care of the elderly and the poor as promised, how are they going to take care of 258 million people?
Among other things, the sponsors of Medicare promised in 1965 that the total outlay in 1990 would be $9 billion. It turned out to be $95 billion. Even worse, the gradualists then were able to force younger people to subsidize those of us who are older, and instead of the government owning the healthcare system, it merely regulates through thousands of rules and regulations that you'll hear about on future programs. That same process continues in virtually every sphere of our political life in America. Check McQuestionTV.com, follow us on Twitter, and keep watching, as for 25 years we've talked about things that really matter to people who really care.
A DVD of this program is available for $20 plus $5 postage and handling, and in Texas, applicable tax. For more information, call 214-750-5157 or email NikkiN@NikkiMcQuestion.com. Visit our website at www.mcquestiontv.com. You can also follow us on Twitter at www.twitter.com/McQuestionTV or download McQuestion TV video podcasts on iTunes. Production of McQuestion is made possible in part by individual viewers, supporters of the Foundation for Responsible Television, CF Accountants and Consultants, adding value to clients throughout the region, the University of Texas at Dallas, creating the future. Thank you for joining us in our 25th year of Conversations That Matter.